We also were able to realize, I think it was about $30,000 of savings just in staff time because we didn't have to have so many people touching just one piece of paper.
Quality improvement is important because it works. Quality improvement is important to our community and our organization. We found that quality improvement has improved our operational efficiency, customer satisfaction ratings, and our bottom line. We've had several projects here at Greene County Public Health. We did a project with purchase orders and we reduced our cycle times. We did a project with wait times for our customers and improved customer satisfaction. And we reduced the amount of time that it took to report communicable diseases. And that impacted our community health outcomes. We've learned several processes here, and all of our employees are trained in quality improvement. We use Lean, we use Kaizen, and we've had several Greenbelt projects. Any agency not involved in quality improvement is missing out on enriching their organization and really fulfilling their mission in a more meaningful way.
So for Lean Six Sigma, I got some Greenbelt training, and with Greenbelt training, I did a project with our environmental health team to look at our process for reported dog bite or animal bite incidences that need to be investigated for rabies. So we looked at making that process easier for people to understand, and then how to shorten the length of time it takes to go through that process of investigating an animal bite. So we really looked at the form for the first time possibly ever and looked at how we could make it easier for people to understand. And so we saw that people became more compliant with the instructions once they could understand them better. So we think that really improved our customer service and our ability to serve our community.
We saw some pretty quick benefits when it came to especially one of our programs, the rabies program. That was kind of a clunky old way of doing things that resulted in a lot of duplication of work, a lot of unnecessary trips. And so when we took a look at that procedure, we streamlined it so that it made it easier for us to communicate with the client and to save time and accomplish our goals.
This morning, we had a vomiting and nausea at area hospitals. And because of that project, we were able to involve directors who are able to allocate resources and enhance surveillance of their staff to make sure that if it is an outbreak with a focal point of, like at a restaurant or a food service operation, that people will not be exposed and not end up in the hospital or perhaps even dying from that outbreak. So this has had real results, and we ended up saving over $50,000 a year in lives saved because of that project. So it was a wonderful project and had real results.
So one of my first projects here working with Lean Management was doing a purchase order process. And what we really did was looked at how we were making purchase orders, like writing them up, and truthfully a lot of what we did was printed off the purchase orders. It was a largely paper-focused process. So we looked at how many steps were in the process, how many people touched that one piece of paper, and really around that time we were looking at going kind of electronic with the purchase order process, so it was kind of the perfect time to look at it from a lean perspective. And so one of the things we saw once we did introduce the idea of doing purchase orders electronically was that we cut the time probably well over by half in terms of people touching the piece of paper, which is no longer a piece of paper actually. But we also were able to realize, I think it was about $30,000 of savings just in staff time because we didn't have to have so many people touching just one piece of paper. So it was good for staff. They had more time to do other things, and I think they really enjoyed seeing a change with this process that had been done here for decades the same way.
Through this opportunity with Strategic Leadership Solutions and the Lean Ohio project, we were able to train nearly 70 members of our staff and through the Lean Ohio boot camp. And we also had about 20 staff to go through the Greenbelt training. And through that project, we were able to complete 4 quality improvement projects in different areas in our agency. Additionally, we did a Kaizen project where we dealt with disease reporting and some problems that we were having there, and that has been a tremendous help to our agency.